welcome to our healthcare symposium, the Ladipo Group's healthcare symposium. Today's session is addressing burnout in healthcare professionals. And really glad that you took time out of your day to join us for what I think will be a fruitful session. So really glad that you're here. Let me tell you a little bit about me and the company. So my name is Tonya Ladipo, and I founded the Ladipo Group in 2004. And I'm a licensed clinical social worker by training. And I worked in a lot of community behavioral health, mental health agencies before starting the Ladipo Group. And the burnout that I experienced there was very real. A lot of stress that was passed along from leadership to management to direct line staff. I would say not the best professional working boundaries. So a high pressure situation with low pay and long hours. So definitely experienced a lot of burnout there. And started the Ladipo Group really as a way to give great services to the Black and African American communities, great therapy services, and create a workplace that was going to be healthy for the people who worked there as well. I started, as I said, as a company for serving the Black and African American community, simply because when I was in community mental health, I didn't see great service being given to Black folk, and I wanted to change that. And then in 2010, we really expanded our offerings to work with organizations, because we realized a huge source of stress that people experience is in the workplace. And so if we can have an impact on how people work in the workplace together in a way that is effective and respectful and provides opportunities for everybody, that we can have a greater impact on all communities. And so we still do our therapy practice, and we actually specialize in being a mental health EAP provider within organizations that have, kind of traditional EAP services. We are an EAP provider that specializes in working with underserviced communities. So really the idea is how can we live our lives better that has a greater impact on the work that we're doing, right? That's kind of where we're coming from in the work that we do. So we're just going to ground ourselves with the reality of burnout, the definition, the impact of it. And then we're going to talk about the organizational solutions to address burnout and the individual solutions to address burnout, because both are necessary. One isn't possible without the other. And then again, please ask any questions that you have along the way in the chat, and I'll be sure to answer them at the end. So let's just talk about a little bit about what is burnout and its impact. So who defines burnout as a syndrome resulting from chronic workplace stress, characterized by three dimensions: feelings of energy depletion or exhaustion, feelings of cynicism or negativity related to the job, and reduced personal efficacy. And so, reading that, and then also noting that it was included as an occupational phenomenon, so not a disease, but a phenomenon within the International Classification of Diseases, I think really helps us understand that burnout in healthcare it's not a catchy phrase, it's not a trendy phrase, but it's a serious problem that is impacting healthcare workers, and then also the people who get serviced by healthcare workers. So really what this means is it's impacting everybody. The Surgeon General considered burnout like a necessary thing that we have to address, because otherwise the weight of the pressure is going to create more harm. And so really understanding that addressing burnout isn't something that would be nice to do at the end of the day if there's time, but it's actually critical for the success of our healthcare system. So when we're talking about, I think the pieces of one and two, are obvious, right? You're exhausted often, most of the time. You feel like you don't have energy, even if you've slept a full night's, full 8 or 9 hours of sleep, which might sound for some people like impossible to imagine getting that much sleep. But even if you had a full night's sleep, that you're still exhausted, and not just for one day, but over an extended period of time, right? And feeling really cynical and negative about your job and about the healthcare industry. I think we all kind of understand that, and especially since the pandemic has really highlighted reasons people have those experiences and feel that. But the piece I also wanted to kind of pull in is the reduced professional efficacy. So when you are constantly depleted, and when it's not that you don't feel good about your job, but when you are cynical, when you have constant negativity about the work, that translates into patient care directly, right? And so that means patients don't get as great of care, which is why addressing burnout in healthcare amongst healthcare professionals is so critical, because it is necessary for the wellness of patients, and it's necessary for the wellness of healthcare workers. I think sometimes healthcare workers get overlooked as being human too, and they have their own challenges and struggles that they're managing. And so addressing burnout to tend to us as humans, and also to improve patient care as well. So just to talk a little bit more about what is actually the impact of burnout, just a few statistics that we wanted to share with you about what the impact of burnout is. So in one study, 52% of nurses and 20% of doctors were expected to leave practicing in the healthcare industry, in the field of medicine, because of burnout. And of those in that survey, 27.8% were who were considering leaving were twice as likely to report suicidal ideation. I think mental health needs and services amongst healthcare professionals is often overlooked, much to the detriment of that individual and also patient care. Because as I said, we're professional, we're humans too. Healthcare workers are humans too, and we need support too. And so those who are experiencing burnout, 48% are experiencing some mental health condition, PTSD, depression, or anxiety being the top three. And then talked a little bit already about how burnout contributes to poor patient care. And so I think, we have lived through this, and I think it has been highlighted by the media in the pandemic, but I'm not so sure that we've been addressing it from let me say it differently. We have not been addressing it from a systemic perspective, as the Surgeon General has kind of declared needs to be done. I do want to just say, if you have a chance to see anything in the chat about, what your experiences are with burnout, what they have been, would love to hear that from you. I think how burnout shows up for us is different for everybody. So would really love to hear from you some of the experiences that you've had with burnout. Let's talk a little bit about organizational solutions to address burnout. Sometimes I think this is true for a lot of organizations and a lot of institutions. I think sometimes when there's a problem that's identified, it sometimes feels easier, I think, to look at the individual and say, okay, well, there's a problem. What can this one person, what can we do for direct line staff? What can we do for admins? Kind of what can we do for individuals? And I think that's a really necessary part of the equation. But the systemic part of it, the organizational part of it, is just as important. So if you only look at paying attention to solutions for individuals without looking at how is the organization actually going to support that, there's going to be a big disconnect, and there's not going to be a true solve for the problem of burnout. So my father is a physician. So I grew up, watching him work multiple back-to-back, an emergency room physician, So, well, back-to-back days and nights, not knowing if he was home for dinner or breakfast, extreme working hours. And that was just part of the job. That's just what you did. And, it's interesting, now he'll even talk about how some of the people entering the healthcare field are pushing back on working those type of hours, saying like, no, I will work one less shift. I will get less money. I'm not working that way. And I bring that in to say that when we think about organizational solutions, sometimes the way our organizations and systems are set up promotes burnout. Like when you set up a system where somebody is working 12-hour days, 5 days in a row, it's hard not to experience burnout, right? And so looking at it from an organizational perspective and putting things in place that really will address burnout, minimize it and reduce it, and then ideally prevent it, right? It doesn't mean we won't have stress. That's part of life, but stress and burnout are very different. And so some research has shown that these three solutions from an organizational perspective really positively impact healthcare workers' experience of burnout. So the first one is for your healthcare organization to create a robust workplace wellness program. So having offerings that are going to really support healthcare workers. And so that could be a variety of things. That could be meditation, that could be movement classes, that could be quiet rooms and spaces, right? So there's a lot of ways that workplace wellness can enhance the daily work day and reduce burnout, but really kind of being thoughtful, not just kind of like, oh, let's do a quiet room, but like creating a thoughtful plan and a thoughtful program that is going to fit your specific organization's needs. The other piece of that is monitoring and encouraging PTO usage. So a significant part of burnout was people not being able to take time off and not having enough of a break. And so research has found that when people take breaks and have the time off, it really does help combat burnout. Now, I realize that what I'm saying for the healthcare industry in the United States to, take and encourage PTO usage might just seem silly, frankly, because that's really not how healthcare works. It's a 24-hour industry. And frankly, in the US, we don't take a lot of time off. So I recognize that what I'm saying might not feel like a reality. But when the Surgeon General says that addressing burnout is our moral obligation, it means we have to do things drastically differently. And so people have PTO, they have paid time off. And how, from an organizational perspective, are they being not only encouraged to use it, but it's monitored to use? And so is that on a quarterly basis that you get a report of, you have this many days left, you need to start using some this quarter to encourage people to take it, and that they know they're going to get, so there's going to be some oversight from the organization to encourage them to take their time. And then the third piece, we talked earlier about the impact of burnout on PTSD, depression, anxiety, and suicidal ideation, really having strong mental health services for healthcare professionals. I think the stigma around seeking mental health treatment, I think, is actually decreased because of the pandemic. I think that's actually been a surprising outcome, I think, of the pandemic. Yet there are still some positions, and there's still some people still have some positions where they do have concern for seeking treatment because they wonder, how is this going to be perceived by the licensing board? How is this going to be perceived by their supervisor? And so I think, the need for really good mental health services that healthcare professionals can access without fear of impact on their job is going to go a long way in helping to manage and reduce burnout from an organizational perspective. So I'm curious to hear from you. And again, we'll open up to questions soon. I'm really curious to hear what you might have seen within your own organizations. Like, what programming have you already seen done to combat burnout? I'm curious to hear from you what has worked really well, what didn't work so well, but maybe a few tweaks could be made, or maybe it just didn't work. But would really be curious to hear from you what you've seen from within your own organizations to combat burnout. We talked about organizational perspectives and solutions to addressing burnout. So organizations can have the best wellness programs, available. They can have great mental health services. They can encourage PTO usage. And then us as individual people, we still have it's time for us to kind of pick up that leg of it and take it further. We still have responsibility. This is how it goes hand in hand, right? The responsibility of the organization and the responsibility of the individual. And so what can we as individuals do within our organization? 3 things that, I came up with. Be very curious to hear from you what works for you. But creating a routine to decompress from work and leave work, especially in the way that, in the way we work. And the way because of technology, the way we always have access to work, even if we're not on kind of working hours, to really mentally and even physically give yourself an indicator that your brain needs to shift, that it is time to stop working. And so whatever that could be, it's different for everybody, right? So for some people, a routine to decompress from work is their commute, right? So however you commute to work, that's part of the routine. Some people read a book, some people listen to music, some people write, some people look out the window. But that's part of making the shift from leaving work to going to home. Other people change their clothes. That was actually something at the beginning of the pandemic I committed to myself. Now that we're all working from home at that time, I made a strong commitment to myself that I needed to do something to indicate that work time was over. And so I would intentionally get dressed in work clothes. And then at the end of the workday, I would go put on kind of home clothes. And so whatever it is for you to note that it's time to decompress yourself and make a shift to home. The second thing is to strengthen the support you have outside of work. We have to have lives outside of work. I think people and activities that remind us that work is a part of our life, but not all of it. And as great as it is to be able to talk about work with people at times, it's really great to have people who might not really care what you do because they're so excited to do this activity with you. And so really to strengthen that support for yourself outside of work. I'm looking at some of the chats that people are putting in there. And I love the idea of making lists, wish lists, and kind of playing around with like what it is that you want to be doing. I think of kind of visioning, like what gets you excited in life and spending time doing that. And then scheduling breaks throughout the day and year. So just like we're saying from an organizational perspective, it's important that they encourage and monitor PTO usage. As individuals, it's important that we monitor our own PTO usage and that we use it. And so I use this example often because I've really kind of latched onto it. But there's a team member who from day one, whenever she took a vacation, she would come back and know when her next vacation was planned. And it was really kind of surprising to me, like, wait, what? You just got back from vacation? That was such an intentional way. Even if she wasn't traveling anywhere, she knew when she was taking more time off. It was such a deliberate and intentional way of planning to use her time, which really minimizes burnout. So I think it's an incredible strategy to use. And then you see it intentionally says taking breaks throughout the day and year. So yes, planning breaks throughout the year, planning breaks throughout the day. And again, I realize that might sound impossible. And we can make what sounds impossible very possible in a reality. Because when I'm talking about breaks throughout the day, I don't mean taking 3-hour breaks. I think sometimes we can make time for a 15-minute break. I think actually a lot of times we can make time for a 15-minute break. Yet it doesn't feel like it. Because we're always on the go. Somebody always wants our attention. Somebody always needs something from us. And if hearing me say that taking 15 minutes in your day to do something that is not about work, which, by law, we're all required to have break time. If that even feels like it's too much, then think about doing something for 1 or 2 minutes. And let's push it to 3 minutes. So imagine giving yourself a break to listen to a song. Imagine giving yourself a break to look out the window if you have a window at work. Imagine giving yourself 3 minutes to take a walk around the block. And if that is not accessible to you because the physical space you work in, it might take longer than 3 minutes to get out of the building, right? That you go to a different floor and you just kind of take a lap, but you just start moving your body. But giving yourself time to take breaks, I think is really, really a necessary part of working well to reduce and minimize burnout. I just wanted you to kind of see some of the possibilities to consider of how individuals can do this. One of the resources we're going to share, you see one of the bullet points says daily breathing breaks. We generally do not take deep breaths, which means that we're not getting enough oxygen to our brains, which means that it's not running as optimally as it could. So even just the idea of taking deep breaths so that we could work more efficiently, that will hook some people to want to do it. And other people want to do it because they're tired. They're tired of being tired. And taking a deep breath just gives them a bit of relief. And I think that's really important. What I would love for us to do before I open it up for questions, I'm going to go to the next slide. I would really love for you to consider what of this could work for you, right? I don't want to give so many action steps that it becomes unrealistic. But I think for yourself, from an individual perspective, just jot down what could you do that will work for you or you think will work for you to decompress after work every day, right? Same thing, simple thing that's going to work for you. Jot that down. If you want to put it in the chat and share with us, that would be great. If you just want to jot notes for yourself, do that. Also think about what brings you joy outside of work. And so know that for yourself. Sometimes we'll get stuck into habits that aren't necessarily good for us. So habits of scrolling on social media, that might feel good for 10 or 15 minutes, but then you've been doing it for an hour and a half and it's not feeling good anymore. And so being more intentional of like what actually does bring you joy outside of work that you can be doing. And then taking some time, imagine mapping out, looking at how much time off you have left or you have. And for the next 3 months, just consider the next 3 months. What time off do you want to take? And start thinking about what you want to do with that time off. You don't always have to go someplace. You don't always have the financial resources or the energy or the wherewithal to travel. It doesn't mean you still can't take time off and really rest and enjoy that time that you have to yourself. And then the second thing that, because you can't have individual responsibility without organizational responsibility, I would really love it if you would contact your organization to learn what is their burnout prevention plan, right? So if this is a moral obligation, right, says the Surgeon General, if that's true, then what is your healthcare institution's plan to minimize burnout for healthcare workers? How are they going to go about doing that? And so if you go and you ask, like, I just went to this session and it made me think, what are we doing? What's our plan? Hopefully they have something, and maybe they don't. And so then if they don't, that's a great opportunity to continue the conversation and say, well, what can we do about it? That's something that I think is really important. And, at the Ladipo group, that's certainly something that we can also help organizations design and implement. So I think starting the conversation, seeing what they have, and being able to kind of have joint responsibility from an organization and an individual perspective to really address burnout is key. Let's go to the next and final slide before we open it up for questions. So you'll have access to this so that you can, do more research, more reading if you want. So there's an interview there with Dr. Murthy, another resource to learn more about burnout. And then the top one is, I use it on my desktop, but I'm sure there's an app too. It's a customizable breathing exercise app, right? And so it can help you, it like kind of guides you in very simple ways through breathing. And so sometimes that external accountability, even if it's just an app to help you breathe, can be really, really, really useful. So at this point, I would really love to hear from you. I would like to hear kind of if you have any questions about what I said, comments, thoughts. Would really love to hear what you have seen organizations do that work to prevent burnout, or even what you wish that they would do. So I'm going to pause and also start reading the chat to see if there's any questions there, but feel free to put your questions in the chat so I can answer them there. I love the comment earlier about encouraging staff to seek quality mental health services, right? And also your point of modeling it, normalizing therapy as a form of healthcare. It's so funny. It's right. Physician, heal thyself. It's so often people in the profession don't take advantage of the profession, though it would benefit them just like it does everybody else. So I think definitely normalizing the benefit of therapy as a way to manage burnout, prevent burnout, and just be healthier, right, in our life and working world. I also love the example of wish lists for Amazon and Etsy, and just thinking about what you want to be doing. Oh, I saw the comment about walking your puppy and enjoying his excitement. Thank you for that. So many points of that. So at the end of the day, which is a great decompression tool for you and great for your puppy, and it needs to happen, you go outside, you get fresh air, you get vitamin D from the sun, even on a cloudy day, and you get to see the excitement from your puppy, which then spreads to you. And so I love that point. And I think also for people who might not have puppies, how do you kind of see joy in other people or things that also then brings more joy to you? So thank you. Thanks for that example, Carla. Listening to music, that is a big one for me too, just as a way to decompress. And I want to see if we have any. So what works, giving space for each care provider to determine their census caps versus being determined by outside factors like insurance reimbursement. I appreciate that. And so, what you're bringing up is some of the real challenges in the way the healthcare system is structured. I think I was reading that physicians do 2 hours of paperwork for every hour of seeing patients. And so the idea that there's so much, there's a lot of things that are imposed on healthcare workers. And I mean, from my perspective, I understand why there need to be standards, right? There needs to be oversight. But to your point, how can it be shifted in a way that allows the healthcare provider to do their job well, with the patient in front of them? So thank you for that point. Oh, I love that idea. That you wish large organizations could have a counselor on staff, like school counselors. That is, I think it's a brilliant idea. I love that idea. That's so smart. Um, that is so smart. And as you said it, I'm thinking, they have large institutions, at least hospitals, have chaplains on staff. And so, right, it's another way of tending to the needs of the healthcare workers. That's a great idea. Okay, I'm reading. My concern is that it often feels like lip service is being paid to this topic. So much attention and promotion is made to employee well-being, but the unrealistic expectations of staff do not end. And sometimes slights made toward ways in which people do take care of themselves are made. Yes, 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 that makes sense. That makes a lot of sense. This is why as we were designing this, I really didn't want to just focus on what individuals have to do to address burnout. Because it does have to have a systemic basis to it. And to your point, to say that we support employee wellness and we have programs for employee wellness, but then there's snide comments or we look down upon people who take advantage of them, right? Then you are right. Then those programs are in name only, but not actually in practice. And it for it to work well in practice, there usually needs to be a bit of a culture shift to realizing the importance of it and willingness to do some things different as a result. So I'll give an example. For us at the Ladipo Group, one of the things that we've done a couple of years ago, in terms of PTO, PTO ends at the end of the calendar year very intentionally, because we expect you to use it throughout the year. And if you carry it over, and we don't want you to carry it over, so we end it instead of having it being carried over. And we also kind of put some parameters in place that if you take an extended period of time, I think it's 3 days or more, consecutive days off or more, that first day back, you don't have any meetings scheduled, so that you have in the morning, so that you have some time to catch back up on emails and kind of to reintegrate into your work, and you're not just kind of coming right back into it. And so if we had put that in place, and then every manager was rolling their eyes, every time somebody's like, I can't do it, I'm just getting back from vacation, then it wouldn't be real, And so it needs to be, that's why I say it needs to be of a culture shift in terms of leaders and those kind of putting these programs in place to really not just allow usage of it, but to promote it. And I would say even to model it as well, which is a reminder to myself as well. I see long waiting times, especially in Canada. And I don't think that is just unique to Canada, but I appreciate your point, Cheryl. But long waiting times to find a counselor, unless you have insurance, is hard, which makes me go back. It makes me think about the other person's suggestion of, wouldn't it be great if healthcare organizations, large ones especially, had people on site specifically for employees? In addition, of course, you want to service the patients, but as I said at the beginning, we're human too. And so really prioritizing healthcare staff as well. Carol, yes, please. You wanted to say something? Please go ahead and unmute.
You responded. That was my comment about the larger sort of cultural shifts needed. And I'm a manager, so actually I was multitasking in the beginning of this call. And one of the things I was doing, you actually referred to, was PPL time off requests. And so even something that feels as small as someone requesting a time off because they need to take a day off, our policy says you were supposed to have requested that more than 48 hours in advance. So technically, I should not approve it. I'm approving it. I approve it. But then we also come into an area that I emphasize a lot: consistency. among managers, consistency in implementing policies. And so that is, it can seem very small, and I have my practice, but then I also try my best to influence some of the ways in which we implement policy or can eventually change some policies. So that comment I made about, sometimes slights being made. So there are things that work for me that I absolutely positively to do have to do, whether it's the music that plays in my office, and I'm thankful I have an office, whether it's literally the lighting in my office, or when I go to get a cup of coffee, instead of walking through the building, I go the long way outside, around the corner, in the front of the building. And I really strongly encourage other people to do that, because I know that for me, I'm no good to them. I'm not doing direct practice anymore, but I am no good to them. And I can feel the difference with me when I take better care of myself or not. Um, and but even I, a 27-year employee, um, have to intentionally be comfortable and maintain my comfort in saying, yes, me doing volunteer work for voter registration day. Some people look at it and say, well, how could you do that? Must be nice to have the time to do that. That is a form of self-care for me, as much as it is performing a volunteer activity that is essential for us to be able to do.
Carol, thank you. Thank you for all of what you said. And you gave a really great example of how to take a break within your day that you've just incorporated into your day. You get a cup of coffee every day. You just made sure you got some time outside. Right. So I really appreciate that concrete point, along with how managers, I would say, have responsibility and also power to really support their staff, right, in minimizing burnout. Managers are in a hard place because they have their own managers that they have to report to. So it's not, I don't want to say it's all powerful. I think it's a hard place to be in. And so, but how can you use that? Like you were saying, Carol, like it's less than 48 hours, but you know that person needs to take care of themselves. So you're going to improve it. But I think kind of managers being able to make those decisions goes a really long way. And I just want to say one thing before I close it out. You said, Carol, you have to get comfortable with kind of taking that time for yourself. And what I would say is, I think that it takes time to get comfortable doing it, and you should do it even before you get comfortable doing it. Right? I think it's a really great example. Like, we might not be comfortable saying, you know what, I need 15 minutes. I'm no good to anybody right now. I need a 15-minute break. That might feel really uncomfortable. Yet still be the wise decision in the moment. So thank you, Carol. Thank you for saying that. We have a survey that we would really love you to take, because we want to hear from you. We want to know what was really useful about this session, what you want to hear more of. One of the reasons we really were focusing on healthcare is because there are very few industries where it's a matter of life and death. And so when healthcare doesn't get it right, like, people's lives literally are on the line in a way that is just not true for other industries. And so whether we're talking about, making health equity a reality, whether we're talking about minimizing burnout for healthcare professionals, the whole goal is twofold: so that healthcare professionals have a great place to work and patients get great care, right? Which is why people go into healthcare. And so I just appreciate you joining us for this session. I appreciate your comments and interaction, and really, really would love to hear from you about what you want to hear more of. So thank you for joining us, the Ladipo Group, for the Healthcare Symposium. Last week we did healthcare in action, health equity, making it a reality. And then today, addressing burnout in healthcare professionals. So thank you for being with us. Have a great rest of your day.